but we want to give as much time as we can to our speaker for today. So today we have Michael Chapman with us, and he's a subject matter expert and a frequent public speaker when it comes to healthcare and insurance matters. Mike is an insurance broker that specializes in employee benefits, and particularly health and life insurance. He is a Circle of Champions Award winner with healthcare.gov and is listed on the healthcare.gov website as one of the only few agents in North Texas that's been actively involved since the inception of healthcare.gov. And he represents all of the ACA and non-ACA healthcare options available in North Texas. And he also represents all the leading Medicare plans available in North Texas and assists eligible Medicare recipients in seeking Medicaid and other assistance, and then Medicare plans that are designed for critical and chronic diseases. And I can speak particularly on behalf of Michael and his work. Both my wife and I have benefited from him. One, he assisted me with life insurance, or I would say a life insurance co-op when I was in job search a few years back. And then he also helped my wife identify what Medicare plan was going to be right for her, and she turned 65 last year. So, and unfortunately, I'm a few years behind her. So she robbed the cradle. So, but anyway, that's for another day. But anyway, so once again, I just want to say, Michael, we appreciate you taking time to be with us today. And as I mentioned, he is recording this session, as well as in his presentation that will be distributed later this week, he does have links to his YouTube channel where you can check out and watch his recordings. But with that, Michael, I want to turn it over to you.
Thank you. And I have some kind of a conflict going on between Zoom and my recording program, Camtasia, which is a professional recording. So just in case you're wondering, I do have all my clothes on. And on my lapel, I'll mention this at the very end. You can't see it, but there is a blue ribbon, and I have 6 years since being treated and diagnosed for cancer, and I am cancer-free. And I'm going to talk about that, the importance, no matter whether you're employed or not employed, that you don't be cheap and you keep up with your, especially guys, because you think you're, like me, we think we're bulletproof, and because we never go to the doctor, we think we're healthy. And a $70 blood test at Quest or LabCorp or something like that can keep you from much worse, or keep you from having one of these blue ribbons on your lapel. So just a word to warning. Now I'm going to get started here. And first of all, Clayton covered all this a lot better than I could, but I want to let you know that I know what I'm doing. Okay, I'm licensed in 18 states. I wouldn't be invited to speak to these groups if I didn't do the right thing. And I really know my stuff. And also, just like I mentioned, I have a personal perspective because I've been a job seeker. In 2023, I became a single parent responsible for 2 kids who were in grade school at the time, and saw them through junior high, high school, and college, supported them. And during that time is when I decided, there's more to life than being a hotshot for a corporation. And as a responsible parent, I decided I needed to do something different. I've never looked back. It took a while, but those of you that are considering becoming self-employed, I can tell you I've been doing it for a quarter of a century. And while, the compensation may not have been what it was in the past, there are so many other benefits in terms of independence and being in control of your own destiny that I could never imagine working for the man again. So just want to start with that. Now, here's how I can help. All right. And this is my value proposition. And I put a lot of effort into this presentation. And I want to thank Matt Keelan. Shout out to Matt Keelan, who many of you know, who greatly enhanced my presentations with bringing my presentations up to something that is easy to understand. So my value proposition is really to help you get hired faster and to reduce your cash burn. We all have overhead expenses, right? Especially if you have a family, a spouse, you have a home. So the sooner you can get back employed and have income coming in, that reduces and stops your cash burn. And nothing can chew up cash faster than trying to do everything yourself, whether it's trying to use TurboTax or figure out your own forms, or in this case, the incredibly confusing rules and regulations governing insurance, specifically health insurance for individuals under 65 or over 65. It's constantly changing and regulating and subject to the whims of regulators and politicians at the state and federal level. And, there's no cost for my support and advice. And I support clients for life. I answer a ton of questions from people that just have questions. So you don't know the questions to ask, but I do, drawing on personal and professional experience of almost a quarter of a century. And I live, eat, and breathe this stuff. It is my purpose. And, it is what I do. I spend more than 6 months out of the year staying current and being proactive and developing strategies for the upcoming year. And so I'm surprised at the type of stuff, especially during election year. And this is all available at no cost to you, and it will save you time and possibly save your marriage if you're married, because of the stress that job loss puts on a relationship. So return on time invested, we are all in sales. We've heard that, right? That when you are a job seeker, you are in sales, whether you know it or not. So every hour matters. And the things you want to focus on are networking, interviewing, and your family. And you want to avoid low value activities where you don't have expertise and trying to do all the stuff yourself. And every day I get questions or calls, or usually with no phone number where I can follow up with, that ask questions where they obviously don't understand this. And the best thing, the best advice you can take out of this presentation is to manage your time efficiently, and that will help you land your next role. This is new, and I certainly hope every job search leader in Texas and in other states puts this in their orientation meeting, because these are new rules for 2026. You now have 60 days from loss of coverage to apply for either COBRA or plan through the Affordable Care Act. But most importantly, plans through healthcare.gov or state-based exchanges like Georgia and Illinois, where I'm certified, you have to submit termination documents from your employer that shows that your employer coverage ended in order to enroll in a plan outside of open enrollment. And if you miss these deadlines for either COBRA to enroll or a plan through the Affordable Care Act, you're not going to get covered. And these are the only plans that cover any and all pre-existing conditions. Individual plans versus employer plans. Some of you may know this, but if this is your first swim through a job search and you've been coddled by being on an employer plan or possibly parents' plans all your life, individual plans are a whole different animal. First of all, there are no individual PPO plans available in Texas and in most states. There are only HMO plans, or what's known as EPO plans, that offer no out-of-network coverage other than emergency hospitalization. you're going to see much higher deductibles and out-of-pocket maximums compared to what you may have had under an employer plan. But the costs are based on your age, your household adjusted gross income, in other words, taxable income for the upcoming year, 2026, 25, and 24 don't count, and also your location, what zip code you're in. And this is a year-to-year purchase. And especially this year, the regulations and rules that are in place from politicians who are on much better coverage, they will drive you nuts, because 2026 is a different plan, different rules, different regulations than 24 or 25, and 27 will be different even further. So yeah, I talked about network limitations. Also, probably 90% of the plans are HMO plans that require a referral from a primary care physician in order to see from an in-network primary care physician in order to see an in-network specialist. And if you have to find a new primary care physician because the one you liked under an employer plan is not in any of the plans through healthcare.gov, your state-based exchanges, there is no out-of-network coverage, nor can you get referrals to any specialists you may need. So it's, and that takes time. Not only do you have to select a primary care physician, but you have to make a new patient appointment. And during December and during January, that can take time. And until you have that new patient appointment and give all your intake, then you're not going to get referrals. And then when you do get referrals, you're going to have to go through the same thing if your specialists aren't in the network. So yeah, the most important thing I have years of experience doing this and have access to software that helps do that, is to check network directories. If you call a doctor's office, they don't know the difference between a United Healthcare employer plan or an individual plan. And, you know, each company has multiple different networks. So you're not going to get valid information from calling your doctor's office. Income equation. Your adjusted gross income, in other words, what you get taxed on for 2026, this is what you pay taxes on in 2027. This determines two critical things. First of all, how much you pay, and also your out-of-pocket risk. So if you end up making more money, that's great, but you will have to pay the difference between what you estimated and what your actual income is. So you want to be cognizant of that, because sometimes people forget that and they don't put money aside to pay for that. If you make less money, which is not desirable, then you may get an additional tax credit, but that's not necessarily helpful. Now, also, we haven't had a budget in this country for, I don't know, a dozen and a half years. It's going to continue. The politicians are catering to their constituents right now and trying to gather up votes for the midterm elections in November. And funding the federal government might, and this is my opinion, might be a few weeks away. Premium tax credit extensions, they've been scaled back to the original healthcare.gov amounts prior to the Biden administration. There is a wave of hope, though, that once these elections are over, saner minds may come to some kind of a compromise and have some partial extension of a portion of the premium tax credits that were expanded under the Biden administration. But that's just, you have to go with what the rules are right now. Plans through the Affordable Care Act or healthcare.gov in 24 states cover any and all pre-existing conditions. There's also no limit to how much is covered. Also, wellness benefits are covered at no additional cost if you go to a provider that's in the network. And the only other place that will do this is through employer plans and Medicare plans. So, you can fumble around and fiddle with this stuff, or you can fool yourself that you're healthy. But any other option is going to exclude or possibly deny you coverage for the things you need most, or loved ones that you need most that need coverage. And there are so many scammers out this time of year selling plans that are quote unquote almost as good as plans through healthcare.gov, or more affordable, or may have a PPO plan attached to it, but only limit the benefit to say $25,000 or $100,000 a year. What's the good of that? Okay, how much risk is that covering? Maybe for a short period of time, you want to take that risk, but over a year's time, life happens. Man, I can tell you, I've had 2 conversations in the last 2 weeks. One from a lady who is moving back to Texas, who was just diagnosed cervical cancer, which is a tough one, and she had no coverage. She was taking that risk, and now she, I helped her identify some resources so that when she gets back to Texas, she can contact the like the Cancer Society, and also in each individual hospital health system, so that she may be able to get some what's referred to as charity care. But she's out of luck until January, and that's critical time when you get diagnosed something like that. And I could go on with other examples. Every other option other than plans through Medicare, an employer plan, or plans through the Affordable Care Act or state-based exchanges will deny or exclude pre-existing conditions and have coverage limits. There's also no out-of-network coverage. There are HMO networks or EPO networks. The only difference is, again, neither one has out-of-network coverage, so you have to make sure you see providers that are in the network. But the only difference is EPO networks, you can pick up the phone and talk to any primary care physician or specialist that's in the network. So just be cognizant of that. Also, if you're planning to have a family, or let's say you or daughter, child is pregnant, then you're in Texas, and in most states, your coverage will automatically transition to Texas Medicaid, which operates with a different provider other than standard networks with the plans through the Affordable Care Act. The other thing, I have many clients that bring their parents over to stay with them who are resident aliens, green card holders, or naturalized citizens, etc. Their parents may qualify over the age of 65 for a plan through the Affordable Care Act if they do not qualify for Medicare, and most don't. So now I mentioned that. Now, in terms of managing risk, all right, one of the worst things you could do is to get everybody on the most expensive plan and run out of money because one family member has a serious, expensive, complicated, or life-threatening condition. One way, I'm not saying it's the only way, but one way you can manage the risk versus what it costs is by enrolling the unhealthy family member through COBRA or through a plan through the Affordable Care Act. Many state universities offer a college student plan, which usually has a PPO network, so it'll cover them if they're away from home or at home, especially if they're in another state, and will have a PPO network and is usually available at a lower cost than plans through the Affordable Care Act if you add that person to your family. Also, out-of-state family members. There are no plans that will cover someone in another state if they're part of your family. So that individual in your family needs to enroll in a plan that is available in their state to make sure that they're covered. Again, this is another change. Dropping COBRA early, after 18 months, will not qualify you for a special enrollment period. except if you happen to be, quote unquote, fortunate enough to be terminated during an open enrollment period. So that means you have to elect COBRA for the balance of the year or enroll in a Affordable Care Act / healthcare.gov plan for the balance of the year. There are no ways around that. I've studied it. I've asked departments of insurance. This is the new rule. And previous to this year, there was not the jurisdiction or oversight, and it was, you could blink and get a special election period. There were special elections based on income. If your income was less than 150% of the federal poverty level, and it was possible to make changes. But this year, you have to provide substantiation that you, outside of open enrollment, you have to substantiate by providing documentation from your former employer on either company letterhead or company email that substantiates that you've lost coverage. And that would qualify you for special election outside of open enrollment period. And boy, I sure hope the job search leaders that do the orientation bring these points to the forefront during the orientation meetings, because missing these means for many people, they're going to miss out on insurance. Now, there are what are called, this is a new acronym, there's data matching issues. And this requires substantiation, all right? If your income estimate for next year, which can happen during a job loss, if next year's income estimate doesn't line up with last year's or the previous year's income tax return, then you will have to substantiate that, job loss or other things. Also, anybody, even if you've had coverage in 2025, if you're not a native-born American, you have to substantiate your citizenship or legal immigration status, I-9 or green card, etc., and upload that in order to have that processed and approved. And those, I've had approvals go on for a month. And I can upload that for you through your healthcare.gov account, but just know that you better have PDFs of this information ready in advance before you enroll, because this will now be required before you'll be able to enroll for 2026. Premium tax credits. If you have not reconciled your premium tax credit for the past 2 years, went on your 1040 and the IRS 8962 form is the form that you do this on, and you add that to your 1040, then if you haven't done that, then you will not be eligible for enrollment. Also, if you haven't paid taxes for 2024, paid in April of 2025, you will not be able to get covered for 2026. And then there's, this is just the top ones that are most important for job seekers, I think. But if there's other discrepancies, it might be a wrong social security number for one person or another in your family. You're going to have to get that reconciled before you'll be able to enroll. There's also there's what's called catastrophic plans. Again, I mentioned that the premium tax credits have been scaled back. They're what are called catastrophic plans. Prior to 2026, these were only available for people under the age of 30. But this is an option if you are no longer eligible for tax credits or if you think you have a hardship. But you have to file an appeals form and submit it to healthcare.gov. And that form will then be processed and take time to be approved. I mentioned this, there's very, very few special elections outside of open enrollment, and you probably don't want those. These are things like death, divorce, marriage, remarriage, birth of a child, death of a child, moving out of the coverage area during the year that your plan is on. But you have to verify all of these things. And terminating COBRA, again, does not grant anybody a special election to enroll in an Affordable Care Act plan in 2026. And this applies to everybody. It applies that, whether you're employed or a job seeker, if you're 1099 and rely on plans through the healthcare.gov, and also early retired, anybody that's retired early under the age of 65, whether it was their choice to retire or not. So the message is, don't procrastinate. You got 60 days outside of open enrollment, and there's no rules. So this is going to cause a lot of stress, a lot of conflict between you and your spouse if you're married, and it can cause you to make a very bad decision. And if you delay, then what happens? So it's going to be worse than trying to contact your CPA on April 1st and saying, hey, would you take a look at my tax returns? The worst thing that can happen is that you end up in the wrong plan, make a bad decision, you end up not getting covered, or you end up with coverage that is lousy coverage. Other options, you have short-term health insurance plans. Again, you can, but I don't recommend it. These might have a PPO network, but they will not cover pre-existing conditions. And your pre-existing condition would be excluded, and the application could be rejected. And that's also based on height and weight. There's also a maximum coverage limit. It might have a PPO network, but it may not be a very good PPO network. Even though it may be cheaper, it may not be better. It won't be better than a plan through the Affordable Care Act. But again, if you remember unbundling strategy, if you have one young and healthy, bulletproof male or female in your household that is part of your tax household, it might save money for that person to give you the money to enable you to then not run out of money. But just know that you want to cover it either until you're in either, like right now. There are two open enrollment deadlines. One is you need to enroll by December 15th for coverage beginning January 1st. There's a second one, you can enroll December 16th through the January 15th for coverage beginning February 1st. You could use a short-term health plan if you're willing to take that risk to bridge that time. You could cover someone through the whole year, but remember the risks involved in doing that. Also, Medishare, Christian Healthcare Sharing Ministries, Medishare being the largest one. It was the one that I was on for about 5 years prior to Medicare. It's not nearly as cheap as in the past. Healthcare inflation is running about 11.5% this year. And, it's the fastest inflationary part of our government. And it's also the biggest part of our budget as a gross domestic product. And all these rules and regulations and politicians meddling in it when they don't have to be under this type of plan, they're going to exclude. Okay, so Medishare, they're not going to exclude pre-existing conditions, but they're not going to reject coverage. It may give you access to a PPO network, but just know the options. I'm going to talk a little bit about Medicare. I'm one of the top Medicare agents in the state too. You enroll in Medicare A and B, which is you buy from Uncle Sam. You can't do anything until 3 months before the first of your birthday month. Not your 65th birthday, but the first of your birthday month. Unless you remain on a large employer plan. All right. So that is one option. If you remain on an employer plan after age 65, which I recommend because with inflation being what it is, the longer you can stay on an employer plan and get good benefits, and that provides the funds that you may need in retirement rather than start tapping those retirement funds now. If you remain on employer plan, sign up for Part A only, and no cost for Part A as long as you or your spouse or your ex or your deceased spouse worked 10 plus years. All right, as long as you did not remarry. Medicare basics, again, once it takes about a month, maybe a little bit longer right now because of the furloughs and layoffs to get a Medicare card in the mail. Once you get that Medicare card in the mail, you can enroll in supplemental coverage, either a Medicare supplement plan or Part D plan or a Medicare Advantage plan. I'm not going to go into this, but if you don't, then you're going to have lifetime penalties that rack up every month for the rest of your life, and you can't take them. Again, COBRA. This is another thing to point out in orientation meetings. COBRA is not creditable coverage if you're 65 plus. You run a big risk of being responsible for the expenses that would have been covered under Part A. I get a couple of clients every year that come to me wondering, why am I facing this big bill? It's because your insurance company audited their claims and find out, aha, this person is 65 and that they should have signed up for Part A. You have 60 days from termination of coverage if you're 65 to enroll in Part B. And there's special paperwork and special process to enroll if you're leaving an employer plan at age 65. And you have to do that within 8 months, which is the end of your initial enrollment period. Now, this is kind of like a smorgasbord today. I can't go into the depth and detail that I would normally go into. I have I'm joining the modern age finally. I've kind of avoided it, but I've got a YouTube channel. Somebody asked about this. I put it in the chat at the Medical Insurance Exchange. There are at least 3 2026 Medicare webinars and 3 2026 underage 65 insurance webinars where I go into details. There is also one final webinar this coming Friday from 5 to 6 p.m. and I'll stay and answer questions in the chat and I'll go into more details specific to this audience, but I'll answer your questions in that. And if you want to send me an email with the word webinar request in the subject line. I'll send you the information. A couple of other things I'm going to spend time on because this can be really important, especially for job seekers. There are options to save on prescription medications, including the CanadianMedStore.com. You can see the toll-free number there. You can look at Cost Plus Drugs, Amazon Pharmacy, GoodRx. There's other sources, but another thing is try the Boolean search. You put the medication name and then the words prescription assistance program in quotations marks and use Mother Google to see if you might qualify. And that's paperwork that you and your doctor will have to complete. Also, your parents and my parents probably did this. Ask your doctor if a higher dose pill can be prescribed and then use a pill cutter. Cut your costs in half if it's an expensive medication or in a tablet. Don't be cheap with healthcare. I started with this. I'm going to end with it. I checked before this meeting. A PSA test, guys, will run you under $70 at Quest Diagnostics or LabCorp. And, don't believe that your job is too important or your job search is too important that you can't afford $70. You might spend that much on Starbucks in a month. It can save your life or keep you from being honored to be above ground 6 years later with the blue ribbon on your collar. Also, this is an important resource I found recently. The nafcclinics.org is every free clinic in the country. Those that have registered with it, they will include many free clinics that you and your family can find lower cost, possibly lower cost coverage if need be, if necessary, outside of insurance. And also, here in Dallas, Fort Worth, a lot of the major health systems have these mobile buses where you can get free screenings, as part either separate or part of a blood donation. Use it. So my advice is don't be penny wise and pound foolish. Don't let your cheapness or budgetary concerns get in the way of doing the right thing, because you've got a lot of runway ahead of you. And don't be too proud to ask for help. Do what you do best, focus on return on time invested, and leave healthcare expertise to the professionals. It could be me, or, if you don't like me, I don't blame you, but I'd be happy to recommend some other people that have the same focus and passion and purpose that I do. If you want support, and again, between Medicare and Obamacare, healthcare.gov, this is a link if you're under 65 where you can securely and safely, and this is like Fort Knox, it is encrypted. You can enter your doctor's first and last names. You got to spell them correctly, enter any key hospitals and any prescription information that you have for each family member. Put in the comments area height and weight of all family members, so that I can suggest other plans that might exclude pre-existing conditions. But also, you want to put in there any information, as you want to put all family members in that are on your 2026 tax returns, but then indicate in the comments section anybody that won't be on the plan or is living out of state or a college student. This is a long link. I'm not going to spend time on it. It's posted, or you can send me an email if you're about to turn 65 or if you're already 65, and you'll enter the same type of information, and then I can put you in my work crew, get back to you. And it won't happen today. I'm booked up, but I will get back to you, I promise, and I'll make recommendations and send you plan comparisons. Furthermore, so many people rely on their employer plan for life insurance, and they neglect purchasing individual life insurance. And it only gets more expensive as you get older and harder to get as you get more decrepit in life. But life insurance, there's a life insurance plan. Also, short-term and long-term care plans you wouldn't qualify for right now without income. You can generally get about 20 times your income, but if you don't have income, that's not very much. So I'll be following up with these in beginning in January after open enrollment, but I really suggest there's a life insurance plan for everybody, and you should not rely on an employer. You realize now just how fickle any job is, no matter where you are in the food chain of a company. So don't leave, it can be relatively affordable, but also you don't want to leave your dependents and beneficiaries, having to deal with expenses. So I hope you got a lot out of this. This isn't designed to scare you or to just solicit business. I can guarantee you that over 90% of people that are looking for work or are employed aren't aware of these changes in the rules, and they have no idea how significant these changes are. But if you wait until, if you wait too long, then if you're trying to scramble and do all this stuff, later in November or December, what's going to happen? You're going to take your eye off the ball when it comes to your job search. And the same goes for your relatives and friends and neighbors. It is a massive change in all forms of healthcare, and healthcare is only getting more expensive. The government subsidies have masked the fact that we have just rampant inflation in healthcare, and those subsidies are being scale back. So that's the information. I'm going to leave you with this. You know how I can help you. I suggest you do the retire flow links that I put up, but understand, this keeps me out of trouble, and it is my purpose in life. I've had 20 plus years experience. I literally spend 6 or 7 months out of the year doing, preparing for all the changes coming up for the next year. And I'm one of the tops in my field. And this is all available at no additional cost. I'm a commission only guy. A lot of those commissions are being scaled back. I adjust my programs every year based on what's coming, and what's coming at you for 2026 is that freight train coming through the tunnel. So that's my story, and I'm shutting up and answering questions.
Mike, I have a question for you.
Yeah.
So, back when I was in job search, you made me aware of direct labs. Is direct labs still a viable opportunity?
It is. Yeah, good question. It is. What's happened is Quest and LabCorp since then have opened up retail and websites where you might find it cheaper. And Direct Labs is a franchise, and many of those have gone out of business since COVID or have changed ownership. There aren't as many of them, but I check them all out.
So Direct Labs, at least when I was in job search, Direct Labs they actually use Quest, but the pricing on Direct Labs was like a third of what it was if you went to Quest and went and did lab work directly with them. So that may be some, but you also mentioned there was another one I saw in your presentation.
There's Quest, there's LabCorp, and they're a lot more responsive now with going after retail business as opposed to relying on referrals from doctors' offices. And so I checked them out, but you could do a Boolean search, whatever blood test or, whether it's a CBC or other type of test, just, do a Boolean search for lab work near me or something like that. And you'll come up with dozens of places to check, and through the wonders or not so wonderful AI, you can do some basic price research. There's also some new tests. Grail, GRAIL here, developed here in Dallas-Fort Worth, believe it or not, has it's expensive, but it will test for over 100 different cancers. And if you have a history of cancer in your family, that's something you may want to check into too.
Okay. Do I have any questions in the room? We got some on Zoom. I want to answer if there's any questions for people that are in the room that you have for Mike before we go to people on Zoom. Everybody's good? Okay. Amanda, do you have a question? Amanda Boyle?
Yes. Good morning, Mike. So
Hey,
I am an ACA person, and I received my notice from Blue Cross of what my new premium would be for 2026. Of course, my eyes fell out of my head with that one. Yeah. But my question is, if I enroll in that, because I have until December 15th to enroll in my plan, let's just say government doesn't get its act together and there's no subsidies, could I cancel after paying? Because what I understand is I have to enroll and pay by December 15th to have coverage in January. So let's just say the government doesn't get its act together. Oh, you're not getting subsidies. Could I cancel after making a payment, or what should I do? Because without the subsidies come January, I can't afford that. It's my personal, is $1,270.50 covered a month. And I can't maintain that being unemployed.
I understand, Amanda. Let me clarify some things, because I know I was really trying to get through a lot of stuff in a short period of time, and also the recording will be here.
Thank you.
The December 15th deadline you will be automatically re-enrolled, for one thing. And then it'll be, and the insurance companies, they don't know what you're estimating for next year. So it's going to be based on what you estimated in 2024, which may not be right. So you need to consider, and contact me. I'll be happy to help, but you need to consider what your 2026 income estimate is, and then be careful of the auto enrollments, because it may enroll you in the wrong plan. Blue Cross Blue Shield specifically, if you have providers that you've been relying upon that are in the UT Southwestern network or Texas Health Resources Network, which includes Methodist and Presbyterian, a bunch of others. If you are on the Blue Cross Blue Shield Blue Advantage Network, which is a wider network, more doctors and hospitals in the network, those hospital health systems and doctors will not be in the network for 2026. So it's important that they will be, believe it or not, in the network that is a narrower network, and not all of them, but some of them will be in a narrower network known as the My Blue Health Network, that contracted with Blue Cross Blue Shield. So it not only scrambles your premiums, and that's overall because of the scale back in the premium tax credits. So first of all, the tax credit calculation by Blue Cross in the letter you got, it may be totally wrong, probably is totally wrong. The second thing is that your providers that you're relying on, your primary care physician who's responsible for making referrals to specialists, they may be out of network next year. So you may be spending January and February trying to line up new doctors and getting new patient referrals. So you got to get into that level of detail. If you do it yourself, again, it's going to totally derail your job search if you wait very long to do this.
Okay. Matthew, you have a question?
I do. And Mike, thank you very much for your time this morning. You mentioned something about in-network and out-of-network, and currently I'm using the Blue Cross Blue Shield that was available through the Obamacare, through the Health Care Act. Being that said, does that indicate, or does that mean that I would not be able to see the current physician that I'm at, or would I have to go specifically with what they're saying is in network?
Well, first of all, I have access to tools and technology you don't. If you call your doctors, you're almost 90% sure of getting the wrong information.
Absolutely.
So there are two. Blue Cross Blue Shield in Texas is the only network that is available in every county. But your doctors and your hospital health system, who often employ doctors as direct employees, they may be totally different next year. So you need to do your due diligence, not only on the premiums you will pay, and let's hope that saner minds in Washington, D.C., that's my cute little acronym for District of Grifters, because every politician is a grifter as far as I'm concerned. But everything could be scrambled. And again, if you try to go through this, return on time invested, how much you want to put into this stuff, it's very important. It's very critical that you know this stuff. But if you don't do this, if you don't check these things, then after January 15th, if you find this out on January 16th, there isn't a darn thing you can do about it. And you'll have to if your doctors aren't in the network. So, you'll have to live with what you have for the balance of 2026.
Thank you.
William, you have a question?
Yes, sir. Thank you, Mike. I got caught up in the Blue Cross Blue Shield thing as well. I had a letter week or so ago that my PCP is leaving my Blue Cross, and I'd asked them a question, and they said they were still taking a type of Blue Cross Blue Shield, and they were also taking Ambetter. But I wasn't quite sure that I really understood what they were telling me.
Well, be careful because the communications you get, they're required to send those out. When you call the call center to ask for them, you'll probably be switched to a sales call center, and the people you talk to, they're reading from a computer, a script. But it is good, and that they're giving you early advice that you better check this stuff out. I just mentioned the My Blue Health Network. Your doctor might be contracted within the My Blue Health Network, but that may not be the best option for you. Ambetter is one of the largest insurance companies that nobody's ever heard of. Their parent company, Centene, just posted a $6 billion loss, and like other insurance companies, they are known for claims denial. So and poor member services and horrid agent services. So you have to weigh: do you want to change doctors? Do you want to go to a different, narrower network that isn't available outside of Dallas, Fort Worth, and Houston, Austin? Or do you want to shop around?
Yeah, we'd like to keep this one because basically the whole family goes to him.
Yeah. And, the other thing too is this isn't forever. This is, I look at plans to the Affordable Care Act as plans to tide you over and your family members over until you're eligible for Medicare, which is generally the best coverage at the lowest cost, and your next employer's plan, or plans through the Affordable Care Act that are year to year, and much changes due to Washington, D.C.
Yeah, I'm kind of unique because the policy would be only for me because everybody else in the household is on Medicare.
Well, that's a good thing. That's a good thing. Again, just be cognizant of the time involved here. Just because everybody else has gone to this doctor, you're going to this doctor. Depending upon what you feel is happening with your job search, maybe you want to risk changing doctors, maybe you don't, but that's what you have to weigh.
Okay, thank you, sir.
You bet.
Okay, Michael, we have somebody typed a question into the chat. It says the IRS lost my tax return. I didn't know it until a month ago because I was waiting for a refund, and whereas my refund notice didn't work because I filled a paper return. If I refile before the year's over, will I be eligible for enrollment on the healthcare exchange for January 1, 26?
Yeah, I would try to solicit, if you can afford it, professional advice to resubmit and document all that and get it in as soon as possible, because with the furloughs and layoffs and terminations in all the different branches of government, especially the IRS, it's the normal 30-day processing time may be extended, but who knows?
Okay. Is there another question from anyone on Zoom that I may have missed as I scanned through the chat? I believe I got them, but if there's one, please raise your hand. Yeah, okay, Darren's got one in the room.
Hey, Darren.
Mike, I just want to kind of double check something I thought I heard you say just like a minute ago. Kind of roughly rank ordering your different plan options. That, best option is Medicare. Obviously, that's kind of age dependent. Then would be your employer plan, then something off ACA, and then I suppose below that is continuation through COBRA. Did I hear that right?
Well, it depends on if you're eligible for premium tax credit, and also, I would say not the majority, but over 50% of employer plans have a PPO network, which have out-of-network coverage. probably have a lower out-of-pocket maximum and deductible. So, you have to weigh all those things when you review it. But the Affordable Care Act plan, if your income is, and I go into more depth and detail on the YouTube channel recordings, but if your income is below 150% of the federal poverty level, not only do you get a premium tax credit, but your out-of-pocket expenses, deductibles, copays, and insurance are also subsidized, and more subsidized the closer you get to 100% of the federal poverty limit, which next year for an individual is $16,500. Below that, there's no premium tax credit. So you want to do what you can to make sure that whether it's converting some money in a Roth, if you have money in a 401k or IRA, you don't need to do that until the end of 2026, or convert money into a taxable money that, just like a Roth is taxable, but money that you can then spend to be able, and that's another way of getting or boosting your taxable income up to that 16.5 as an individual. And obviously it expands based upon household size.
Does that answer your question, Darren?
Sure.
Yeah, some of this comes down to answering questions that you didn't know to ask.
So Michael, where in that hierarchy would Medishare fall? Is that
well? Yeah, I was on Medishare for 5 or 6 years, and I was too cheap to get a $60 or $70 blood test. So I'm wearing a lapel, and thank God I'm above ground. There are, if you're not eligible for premium tax credit because your income is too high, then Medishare was an affordable option, which you could supplement you could supplement that with, say, a low-cost accident plan or other plans to reduce your out-of-pocket medical expense risk. It is not since prior to the Biden administration, it hasn't been that desirable because of the high subsidies over the last 5 years. But and the subsidies were extended as part of the Inflation Reduction Act post-COVID. Those are being scaled back to the original healthcare.gov amounts. And for those that were used to the high subsidies, that's a shocker. But, it is what it is. Maybe after the elections, the subsidies get extended. But, you have to go with what you know, which is what the amounts are now. And just make a knowing decision and live with it, but don't take forever to make a decision or make no decision.
Okay. Any other questions for Mike, either in the room or on Zoom?
Okay. Go ahead, Amanda.
Well, yeah, Amanda. Okay, yeah, Amanda, you have your hand raised again?
Yes, sir. So when we go and redo our application for 2026, it asks to estimate your income for 2026. Mm-hmm. Whatever amount we put in that space, do we divide that by 12?
No, it's what you estimate for the calendar year. Now, you may only be on it for 3 months or 4 months until you're eligible for an employer coverage, hopefully. But you may have to pay some of that premium tax credit back. But what's changed is this year, if what you estimate for 2026 is different than what you estimated for 25 or 24, then you're going to have to substantiate that difference, upload it with documentation to healthcare.gov, and then wait for it to be processed and approved. And that can take anywhere from a week to a month by my experience.
Thank you.
You bet.
If we wanted an appointment with Mike, how could we?
Yeah, sure. I don't know if you heard that, Mike. So the question was, if they wanted to make an appointment with you, once again, just remind them how they go about that.
Yeah, sure. Let me go back that slide here. Again, it depends on age. So let me see if I can, if you enter your info here, because, answering random phone calls, literally I'm getting like 3 or 4 hours of sleep last night. I think I was responding at 3 a.m. to clients and Clayton about 4. So I'm backed up, but I'm helping everybody. I'm working 6.5 days a week, and I've got 2 full-time people, one of whom is licensed supporting this effort. So I'm getting to everybody that's a Medicare client and a new client, the same with ACA. But I can't answer random questions, nor take this information over the phone. So the best thing to do is, if you're under 65, is to complete this information. You'll get in my work queue. It's still manageable for ACA clients, but it won't be pretty soon, because just like paying your taxes, nobody pays attention to this stuff until it comes close to the deadlines. So just enter this. It's secure and encrypted. It's safer than Fort Knox. If you put that information, you'll be in my workflow. You'll get plan comparisons and recommendations and a calendar appointment. This is the best way that I've figured out to be able to extend my resources to help as many people in the job search as I possibly can. And remember, I'm grateful for having this purpose, having been a job seeker just like you. And if you're over or are approaching age 65, then email me with in brackets the word Medicare or something like that, and I'll send you that long link that was in the webinar.
Well, I just turned 65, so what's on screen is not.
Yeah, what I will be doing is I will be distributing this later today. So as long as, for those of you in the room, as long as I can read your writing, and you've got your email address written out, I will send this to you. And those of you on Zoom, once again, as long as you registered with a valid email address, then I will send this to you as well. Yeah. So he has provided me a PDF of this presentation. So he'll have all the links in it. Okay. Yeah.
It's very tough turning 65 with the shutdown.
Yeah.
And I can't get into Medicare.
Yeah.
Well, let me answer that. It is, it may be confusing, but Medicare is the best coverage you're going to have throughout your whole life, even better than what you had under your your parents' plan. But the rules, especially on the first 6 months of Medicare, it's like being blinded in the headlights. And I help many people every month understand, and then make recommendations and help them enroll. And yeah, the first 6 months are different, but it's better coverage certainly than plans through the Affordable Care Act or an employer plan.
Vera, when did you turn 65?
September 7th.
Oh yeah.
Okay.
You're still good.
Yeah, you're still good.
Right. Yeah. But I didn't realize we had a funeral, so October is when I started looking into this, and I couldn't log in.
Yeah. Well, what I would do is, and I once again, I have firsthand experience. Michael helped my wife weave her way through the minefield of Medicare. Yes. And we're very solid. In fact, my wife was talking to people at her work who had also turned 65, and they went with other plans, and they go, "Oh man, if we had only known about Mike soon."
Wow.
So yeah, get in his queue.
I appreciate. I'm so glad to have this resource, and I look forward to getting in your queue.
I wish that sounds really crass. Unfortunately, I love helping people and advising people, but I'm trying to spread myself and help people and keep level of service and support up.
You gotta have a little work-life balance. If we work your finger to the bone and you're gone, that's no good. So
well, that's okay. At this point in my life, I'm just happy to have a purpose where I can help someone solve problems every day. And that's my goal.
All right.
I guess one other question we have here is, and I think this will be our last one. It says, how do I estimate my annual income as someone who became unemployed mid-year?
Yeah, I can help. That's probably a private or a side conversation, but you're estimating, you don't know when that job is going to happen. Okay. And you can't use this year as an estimate. You have to estimate next year's income. All right. And just remember, below 16,500, that's a magical number in Texas because Texas did not expand Medicaid. So below 16,500, there is no premium tax credit. And if that is your income estimate, then it's going to be unaffordable. So you want to, there's many ways. And again, this year doesn't count, but next year, maybe it's a side gig. Maybe it's seasonal retail work. Maybe it is withdrawals from retirement funds or conversion to Roth plans. There are other strategies, but below 16.5, there is no tax credit. And you just have to estimate when that next job will occur. And I can help you, on a side conversation.
Okay. Well, Mike, I want to thank you for your time and your expertise today. And once again, it's always a pleasure to have you speak to Fort Worth Christian Network. We try to make this at least an annual event. And sometimes we bring Mike back more frequently than that when he has information that maybe is new or something like that. He spoke with us, what was it, September, I think it was? August or September?
Yeah, that's right. Yeah.
So, well, Mike, once again, we thank you for sharing of your time and expertise, particularly in this busy season of yours. So we'll pray for strength, wisdom, and that God can stretch your hours, right? give you the sleep you need. Okay.
Thanks and God bless. I appreciate it.
Well, so once again, thanks, and also hopefully you guys found benefit from the session today. For those that are new to Fort Worth Christians Network, we always end our meeting with a devotional and a word of prayer. And today our devotional is coming from John chapter 9, verses 1 through 3. And they read this way. It says, as he went along, being Jesus, he saw a man blind from birth. His disciples asked him, Rabbi, who sinned, this man or his parents, that he was born blind? Neither this man nor his parents sinned, said Jesus, but this happened so that the works of God might be displayed in it. Now, this is kind of like, and of course, this is the way people thought back then, is that if somebody was born, it was because of something they did. Okay, well, this guy didn't even have a chance. He was born blind. He didn't have a chance to do anything. But what Jesus said here is that the reason this man was born blind had nothing to do with what this man did or what his parents did. It was nothing they did. And sometimes we find ourselves in job search and we've done nothing wrong. It wasn't that we misbehaved at work or that we were insubordinate, whatever. But we still find ourselves here. We still find ourselves out of work. And what Jesus pointed out to his disciples was this reason why this man was born blind wasn't because anybody did anything wrong, but it was so that God could demonstrate his power through that person. And what I want to just for you to understand is sometimes things happen in your life because God wants to demonstrate his power through you, that he can work his way through you. Okay. And it is, and I think I've said this a few weeks back, and that is this, is that there will be a time in your life where you will face your greatest fear. God will cause you to face your greatest fear. And it's not because he's mean or cruel, but it's because he wants to show you he's bigger than your greatest fear. And so there's times, but God is a good God. God does not punish us. Now he disciplines us, but he does not punish us. Okay, that's what Satan does. But there are times that God allows us to go through difficult circumstances because he wants to demonstrate his love for us and allow us to see his power in our lives. And so that's what I encourage you, and even just pray this week, God, is display your power in me in the situation that I'm in. And that could be that he supernaturally just brings something across your path, whether it be an email or a person that makes you aware of the job that God wants you to have, or whatever, or it's wisdom, or somebody provides you financial resources if you're in a position where you need that. So that's what I encourage you is a lot of times, and I've talked to people, I've been doing this now for 10 years, is that sometimes people, they walk away from that job and they feel like they're damaged goods. Man, I was working there and all of a sudden, no, that's one mentality you want to avoid. You're not damaged goods, okay? And so it's allowing God to work through you and not to allow the enemy to play with your mind. Okay? God wants to demonstrate his love through you, for you, and through you when you are facing difficult circumstances. And so that's what I encourage you, is to dedicate your job search and your situation to the Lord. Because once again, God is a good and gracious God. And he does care for those that love him. He cares for them. Okay? And he ministers. He ministers peace and he ministers grace. And he also will minister joy. Okay? So with that, we'll go, Lord, in prayer, and hope all of you have a really good week this week. So Heavenly Father, we thank you for this time together. Lord, I thank you for Michael and his willingness to share of his time and expertise today. I do pray, God, you will bless him. Lord, I pray, God, Lord, just miraculously help be able him to be able to maximize his time with everyone that he's trying to assist. I do pray, God, you will tremendously bless him. Lord, just cause his business to flourish and prosper, Lord, and grant him every desire that you have placed in his heart. Lord, and for each person here that is looking for work, God, I pray for your peace. Lord, and not only just peace, but I pray, God, for that bridal joy, that God, you would fill their hearts with joy, and even in the midst of their circumstances. But I pray, God, for peace. I pray, God, that, Lord, that there would be a deep settled contentment in their mind. Lord, that they know that they're trusting in you, that, God, you have them in the palm of your hand, and that you're going to guide them through this season of their life. So, God, I pray, Lord, that you will give them your wisdom. God, you'll help them navigate this time, or this time of transition. I pray, God, you'll supernaturally drop thoughts into their minds of things they need to know. Lord, bring people across their path that can share information with them that they need to hear and will be of benefit, and even if the opportunity that person might have. So, God, I pray, guard over their minds, guard their lives, keep them healthy. Lord, and I pray, God, you will prepare them for the position that you have for them. And Lord, as we prayed in the past, we don't pray for just a position. We just don't pray for a paycheck. But God, we pray for a position that is truly rewarding and they find fulfillment. And it's a position that they enjoy going to work at because of the people they work for and they work with. And I pray, God, that this new position will have the salary and benefits they need for themselves and their families. So, God, we commit our requests to you, knowing that you're a good and gracious God. You are slow to anger, and that you're so rich in love. So we thank you. We commit everything to you in your name. Amen.
Amen.
Well, thank you for everyone for being part of our meeting today. And we hope you have a great week. Once again, we will have Sarah Jacob with us next week, talking about how to work with recruiters. So we look forward to seeing you then. So those of you on Zoom, and once again, Michael, thank you. And we'll see you next week.
All right. Thanks, Clayton.